Pink ribbons seem to be all around us. It's part of Breast Cancer Awareness Month. Every October is a chance to bring attention to the disease that affects more than 2 million women across the world. Our Emily Deanne spoke with a doctor about how we should use this month to educate, support, and encourage. Emily.
Well, 1 in 8 women will experience breast cancer in their lifetime, and it's a diagnosis that can affect women of all ages. A local doctor says we should use this month as a reminder to make our breast health a priority.
It's actually recommended that women receive a risk assessment at age 25. It's most important for African American women and Jewish women or women of Jewish descent to get that just because they have some slightly increased risk factors that play into it. And then based on that, you're given a percentage of your lifetime risk of breast cancer. If your lifetime risk of breast cancer is greater than 20%, the American Cancer Society recommends that you receive a yearly breast MRI.
In addition to knowing your risk, Dr. Kessler stresses the importance of MRIs and ultrasounds. Doctors use these images to analyze the tissue and watch for any changes. The tool for breast cancer is a mammogram. Our own Sonia Stevens understands the importance of getting them done and walks us through the painless process.
So this is our mammography machine. Typically for a routine screening mammogram, we take 4 pictures, so that'd be 2 to each breast.
These images are important to screen for breast cancer, as well as diagnose any issues.
So you're just going to step right up against here. Arms are going to stay by your side. I'm just basically bring you on in here. This is going to raise up a little bit to come to your height. Paddle is now going to come down, causing that compression on you.
That's done 4 times, including each side.
So sometimes, since we're on top of muscle, this can cause a little bit more pressure here, so just bear with me. Perfect. One more time, hold your breath and breathe.
All right, so if you're wondering what to expect, the whole appointment's going to take roughly 15 minutes. You get to wear one of these lovely gowns, and then this machine, that part only takes about 2 to 3 minutes. Could be uncomfortable for maybe a couple of seconds. They get the 4 pictures they need, and then you were done.
The images are then passed along to a breast imaging radiologist like Dr. Tom Kessler.
So what we're able to do is we look through these images and we're comparing side to side. We're looking at symmetry. When we talk about breast density, here we're looking at this parenchyma, or the wider, greater part showing up here. So this woman would have dense breasts, or what we would call heterogeneously dense breasts.
This is when 3D imaging is especially helpful.
And so this helps us to see if there's anything underlying the tissue, like if there's a little mass or area of architectural distortion or calcifications. Can also be shown to be easier to see as we look through these images. So this is a really helpful tool to increase our confidence in what we're looking at.
The hope is for nothing abnormal, but he says roughly 10% of women have to come back in.
Of those 10 that are recalled, maybe 1 might have to get further imaging. And typically with 3D imaging, with tomosynthesis imaging, we detect about 5 to 6 cancers per 1,000 women screened.
Women like myself over the age of 40 should have this simple screening every year. Unless there's a family history, then you should talk to your doctor. Reporting at Roper St. Francis, I'm Sonia Stevens.
A yearly mammogram is covered by insurance, but if not, there are other options. You can find out more by visiting our